Great. Good. Hello, hello, Dexter. Good to see you again.
Hi, Christine.
Hello, hello. So, where are you joining us from today?
And coming in live from Manila,
And remind me which part of Manila kasi?
Quezon City.
Where is it?
Quezon City.
Quezon City. Okay, okay. Awesome. Well, good to see you. I'm really excited for our conversation today about Alaga Health and the important work that you're doing to fix a lot of challenges in our healthcare system in the Philippines with this really a super app that you're building with your team, which is super exciting. But before we get to your venture and before we talk more about Alaga Health, let's hear more about you and your story. So Dexter, tell us, saan ka lumaki? Saan ka, saan ka nag-study? And yeah, tell us a little bit more about your family.
Sure. Well, I'm Dr. Dexter Galban, and I am a son of a former OFW and a government worker. And I have undergone training in the field of health. So I'm both a nurse and a doctor. And I just finished my master's in public management because I also am currently working in government. I actually wear three hats: government, private sector, and civil society, because I firmly believe in the value of integration. So in government, I serve as commissioner of the Commission on Population and Development under NEDA. The private sector, of course, I'm working with Alaga Health. And in terms of civil society engagement, I work with a lot of patient groups and youth organizations in order to amplify the message that we need to come together for health and sustainable development.
Yeah. Yeah. Lots of hats. It's amazing. Yeah, I'm just curious, nung lumalaki ka, pangarap mo ba to? Pangarap mo ba na maging, doctor and nurse and public servant? Was that always on your mind growing up?
When I was growing up, I was exposed to the need for quality healthcare, primarily because my grandfather was bedridden. And actually, all my grandparents were struggling with non-communicable diseases, your hypertension, your heart condition, amongst many things. So I was exposed to the need to take care of people because there is really a felt need in every family, at least in the context of the Philippines. Right now, it's hard to find a family without at least one member of the immediate or probably even extended family that doesn't have a major condition that they're taking medications for or that they are managing. And my parents actually encouraged me to pursue a track in health, primarily because it is something that really helps a lot of people and is also a very honorable and good career track for us. So apart from the encouragement, I eventually learned more about the health system and really wanted to come in. And long story short, everything just came together and hoping that we can continue moving forward for health.
Mm-hmm. Yeah. So you mentioned you're an child of an OFW. Was it your mom or your dad?
My dad spent quite a long time in Saudi Arabia, while my mom has been always working with the government as a government worker. So really, my exposure was from private sector and at the same time government. So I know the dynamic interplay between the two. And I found it always very interesting to see how can we bring these two worlds together for something better.
Yeah. Wow. They must be very proud of you.
Yeah. I have been very thankful for my very supportive parents because building a startup is a major struggle, and to have it done from the ground up will definitely require as much support and encouragement as needed, not only in terms of words of wisdom, but also in terms of serving as an inspiration because I also saw how my dad eventually, because of his desire to want to be with us, decided to put up his own business. And
Wow.
that struggle was something that the family felt. And it's something that I also hope to emulate moving forward.
Yeah. Yeah. And do you have any siblings?
Yes, I have two siblings. My younger brother is also a nurse, and then he also finished pilot school. Then my youngest brother is graduating next year, for, graduating with his Doctor of Medicine degree next year.
Wow. Daming nasa healthcare din ah.
Because really, my family ended up really focusing on healthcare because it was something that we felt was essential, particularly having a family member who knows a little bit something about healthcare was always going to be very helpful, especially in a time wherein the access to healthcare is somehow limited. So having a family member that is in healthcare would be a faster route in case there are any conditions that needed to be managed or illnesses that needed to be addressed.
Yeah, that's true. It's very true. I also have a lot of siblings in healthcare, and it's definitely helpful to have that perspective. I don't have a healthcare background. I have more of a business background, but I'm always very grateful for that. I'm curious, when you were growing up, what were some of the things that your parents told you? You know, what were some of those big kind of lessons growing up from your mom and dad?
In terms of the major lessons, one of the most important ones was the value of having a purpose, particularly a purpose towards helping people. Because my family was always oriented towards helping as many people as we can, whether in terms of financials, whether in terms of advice, career, amongst other things. Because my father actually is a son of a construction worker, particularly within the he grew up in the province of Aurora. So he really was coming from a very poor family to the point that he would go to school with absolutely nothing and his footwear would even have a hole. So it was really that bad. And that's where I guess the drive to help people or at least be an instrument towards helping people get out from situations like that keep driving us forward because we don't want to see families go through the same struggle as what my dad went through.
Yeah. Yeah. That's so good. That's so good. And you mentioned eventually your dad started a business too, so he could stay. How,
Yes.
ilan taon ka nun nung nag-start ng business yung papa mo?
My dad was actually an OFW for I think I think almost a decade. Um, and eventually, when I was born, upon seeing me, he decided that okay, this might be my last or my second to the last trip.
Bunso ka ba?
The eldest, actually.
Oh, you're the eldest. Oh, wow.
Yes. So it was when I was born that he started thinking, okay, maybe I should now try to see what I can do in the Philippines and try to make a business work so that I could be with my family. So there really was that realization that given the choice, Filipinos would more likely prefer to stay with their families in the Philippines than be away from them for extended periods of time. So that's also one of the primary reasons why we also want to connect people as much as possible.
Yeah, that's really inspiring. And what kind of business did your dad start?
Eventually, my dad started teaming up with my mom for a training and consulting firm. So really focused on, again, a lot of people engagement, empowering people to learn what they need to do for their work, enhancing their knowledge. So they work with a lot of teachers, accountants, even public servants to fill in gaps in terms of what they needed to know about any new update or any new development in the field of business, government, etc.
And how was that? I mean, thank God, it sounds like nag-grow naman yung business na yon?
Yeah. Actually, I was exposed to it quite early. I think I was about 4 or 5, where then they would bring me to the workshops, the events, the seminars. I would be a young kid saying, "Good morning, ma'am. Good morning, sir," giving all of the registration forms. So it was a fun experience for me. And I really saw how it progressed from being a very small business to a rapidly growing one. So it was something as an inspiration to me.
Yeah.
Particularly because I know that it's something that's possible provided that the team works well together.
Yeah. But that's amazing. So eventually, yeah, your dad was able to stay. The business
Yes.
was able to sustain your family. Hindi na siya kailangan mag-abroad. That's amazing. Praise God. That's so cool. So then you were able to grow up, all together as a family
Yes.
with all your siblings.
Yeah.
And then sa Quezon City, born and raised. Yeah.
Yes.
Went to
Primarily
college.
stayed in Quezon City. Yeah.
Okay. Okay. Saan ka na college? Remind me.
I had my college in the University of the Philippines, Manila. So I had to transfer cities. And I took up nursing there as my undergraduate course.
Yeah. How was that going?
Actually,
A
that
little bit
was
away.
my very first exposure to the realities of healthcare, because then I would end up going to school as early as 4 or 5 in the morning, depends on whether you have duty that day or not. Wherein I would see always, walang mintis, every day the lines outside the Philippine General Hospital, even before the break of dawn, with patients holding their IV fluids, hanging them on a tree, or having a family member hold them as early as that time of the day, just for a chance to be seen by a health professional, because it's a tertiary hospital, a government hospital. So they're really hoping for the lowest possible rates, the best possible care. And people would travel from different provinces all over the Philippines to get there and end up waiting with no guarantee that they could all be seen. And throughout the many years I had studying in UP, I ended up seeing that not much changed over that span of time. So I ended up thinking, what's wrong? What's the missing link? Why is there no improvement? Why are the lines not getting shorter? Why is this still the same condition? So yeah, that was one of the major things that eventually drove me to establishing Alaga Health.
Yeah. Yeah. That's crazy. Nakahang sa tree, yung mga IV.
Yeah.
Okay, so then you had your years at UP, and then from there you continued
Yes.
to study. And so
I
UP.
eventually, no, I transferred to, or actually I ended up going to the Ateneo School of Medicine and Public Health, ASMPH, which has a double degree for Doctor of Medicine and Master's in Business Administration. In fact, one of my other options was to take up law, because policy was something that I've been very interested in, because with the stroke of a pen, you can help change the lives of millions at a time. So that was something that I was very interested in as well, creating changes systemically. So that's why it was very attractive as well. But eventually, I ended up going to Ateneo, primarily because of the double degree program, wherein I would learn about business and health at the same time. So it would fulfill two of the three things that I wanted to do: business, health, and policy.
Yeah. Yeah. Wow. And so during all this time you're going to school, what else was happening in your life? I'm just curious.
Oh, wow.
Yeah.
Okay, so I was not your typical student at all. Actually, since I was in college, I was never your just school home kind of student, where I really dove into a lot of organizations. I loved establishing new organizations, advocacy groups. I love volunteering for NGOs. And that translated even up to when I was training already as a doctor, wherein even after my 24 or 36-hour duty, I would still spend the from day or the day after your duty, doing talks or volunteering, really just packing the schedule, because it's something that I found a lot of fulfillment with. So yeah, that was my engagement. And eventually, I was fortunate enough because of all of these engagements, I ended up getting nominated for a government post and getting that government post. And now I'm spending as much of my time while I'm still in the position to open avenues for other young leaders to participate in good governance, to get involved in healthcare, and hopefully become driven to do something that will help more people in the long run.
Yeah. Yeah. That I can only imagine. Yeah, I hear you talk. I'm picturing you running around all the time as a student.
Yeah.
I can relate. I can relate too. But that's awesome.
Yeah, it was exhausting, but fulfilling at the same time, because really instead of resting or just probably spending a time watching a movie or whatnot, I'd spend what little hours I had left to volunteer or do an advocacy talk, or probably help out in the community. So I found a lot of fulfillment there, and I think that was preparing me for what was to come ahead, because creating a startup, working in government, super toxic, super busy. But still, even when the going gets tough, we have to keep going because there's a bigger purpose that we're working towards.
Yeah. Yeah. And tell me, Dexter, what role has your faith in God played throughout your growing up years and now?
It has played a major role, actually. When I was growing up, between my mom and my dad, my mom was the more religious one, wherein she would encourage us to go to church. Actually, it's still part of my mom's daily routine, wherein she'd wake up very early in the morning, always go to mass and pray. And that has really affected the way the family perceives religion, perceives our faith, and that has translated to us understanding what exactly our purpose here is. Wherein we want to affect as many lives in a positive way as much as possible, so that all of these things are eventually going to be offerings to God. And it's something that has inspired us to remain true to our purpose, and at the same time it has encouraged us to work with a lot of communities, and that is something that has always guided our moral compass, to always ensure that whatever we do would be for the betterment of the community, for the betterment of our faith, and the strengthening of our belief in God.
Yeah, that's beautiful, and praise God for that legacy of faith from your mom.
Really, my mom
and your
really,
dad. Yeah.
Actually, from my grandmother to my mom and then myself. So it was a good way to keep us all together as well, especially during hard times. I suppose one of the things that really strengthen faith would be the challenges that we face on a daily basis, because not only do they guide us towards where we're supposed to go, but they also make us realize that everyone needs help, that everyone needs a bit of inspiration, that everyone needs faith in God in order for us to keep moving forward.
Amen. And today, Dr. Dexter, who is God to you personally?
For me, God is in every person that I meet every single day. Primarily because if I can make their lives a little bit better, that would be me being an instrument of God, because that's our purpose here. For what purpose do we exist in this world than to make this world a little bit better than when we found it? And we won't be here forever. And my goal is, through our limited time here, we make God become felt by everyone else. And I think one of the best ways to do that, and I think this is one of the core things that we saw in Jesus' life, was to heal people. That was one of the main reasons that people flocked to him, apart from his teachings, his capability to help and inspire, and of course, heal people whenever they felt down, whenever they actually felt illnesses. That was very instrumental because he took on a lot of roles as a teacher, as a leader, as a healer. So all of these things I hope to manifest or emulate in my life, even just a little bit every day.
Yeah, so good. That is so true. Jesus was a healer. He was a doctor in many ways. And yeah, that's beautiful. That is really, really beautiful how you see that connection between your faith and your sense of purpose. And now your work. Now your work, it's like you're an extension of that ministry that Christ demonstrated, and enabling that healing and the restoration and flourishing in our country. So, I know it sounds like being an entrepreneur, right? You saw it growing up, and that definitely played a role, it sounds like, in just how your thinking was shaped more with that growth mindset, perhaps that you saw your parents building this thing. And so, yeah, it sounds like you were kind of wired in this way to just be really proactive in building stuff and being out there, putting yourself out there proactively. That's really cool to see how, that's kind of been hardwired in you. But I'm curious, for Alaga Health specifically, your social enterprise, your startup, what was the initial kind of light bulb moment when you decided, okay, I am going to go all in on this venture?
Yeah. So actually, it was something that ended up as a pivotal point after the many years of working with patient groups, advocacy groups, NGOs, and my experiences as a nurse in training then, eventually as a nurse, seeing those lines at the Philippine General Hospital. When I was training as a medical doctor, part of our responsibilities, of course, was to go to the hospital, consult with patients under the supervision of another physician. And I was at the outpatient department then. I came in early, around 5, 6 a.m. And of course, by that time, as what most hospitals would be like, a lot of patients are already outside. And then I remember, for some distinct reason, I was eating my breakfast sandwich at that time. And then I was going into the hospital and I saw this elderly man in the hospital lined up. For some reason, his face and his attire struck. And I went on with my day. And then at around 4 p.m., we were actually about to wrap up already. And here comes this elderly man coming into the outpatient department, because in that scenario, they could go to any desk that had an available seat for the consultation. And then they ended up going to me. And because it's my thing, especially during consultations, to really want to get to know my patient very well, and if possible, make them laugh, right? So I really want to, "Oy, Tay, kumusta po? How are you? Ito na po ba yung huling konsulta? Kasi, kumusta po tayo?" And then, what he said really crushed me, because he said, "Ay, actually, ito lang po yung ipinunta ko today." So it meant that the entire day, he was waiting in line, or that there were a lot of hiccups that prevented him from seeing the care that he needed much earlier in the day. So that meant he missed the work. He wasn't able to probably take a rest, or he spent more probably going there, or even on food that he would have spent elsewhere, just for a consultation that didn't even take 10 minutes. So for me, there is something wrong in the system that needed to be fixed in order for us to stop these kinds of things from happening. So I think that was the major light bulb moment for me, wherein if I can't change it via policy yet, because I'm not in government, or probably I'm not in a position to write laws, etc. Specifically for that, I probably can create a system or a business that can adjunct that, or at the very least make lives of people a little bit better through making healthcare more accessible, available, and hopefully more affordable.
What a powerful story with that tatay.
Yeah. Without disclosing a lot, because patient confidentiality is in play. He is a jeepney driver. with a wife who's also sick, with kids as well. And because of the consult that day, he wasn't able to do his regular pasada. He wasn't able to take in a lot of passengers. So that meant a lost day of work. And as a daily wage earner, that was a major blow to his income. And that would affect also how he would purchase his meds, amongst other things. So in my mind, there must be a better way for them to find healthcare that's cheaper or at least more affordable. And hopefully they could select one that's easily available to them, that they don't need to travel far, and that would already be available when they need to. So that's why we're working on Alaga Health to serve as a viable option to make lives a little bit better.
Yeah. Yeah. That's crazy. 10-minute consultation all day.
Yeah. And it was actually only an adjustment in terms of the dose of the medications. So it's something that we could have done through telemedicine.
I
That's
know.
why we are pushing for telemedicine in Alaga Health, amongst other things, apart from your clinic appointments, etc.
I know. I know. So that's so good. So good. So ano yung first step mo nun? You know, sabi mo nga, di ba? Lahat na ng ginawa mo from young age, college, etc. Parang preparation na yun kasi nakikita mo na lahat yung mga problems, mga opportunities. Siguro, just madami ka ng mga insight. But what was the first step for you toward really...
I think for me, it was serendipitous, primarily because I have no knowledge when it comes to tech. I love tech stuff. I love gadgets. I love all the latest updates when it comes to the tech world. But right. I cannot code. I cannot do any of those hard tech stuff. I'm primarily familiar with health, with business, with government, with systems, and policies related to that. So I eventually ended up being invited because by that time I was still in med school, but I was already appointed as a government official. So I was then invited to serve as a judge in, I believe, what is quoted as the world's largest hackathon in the Philippines at that point. And I ended up judging. And I saw all of these startups from different fields and sectors, from agriculture, etc. And then I ended up seeing, oh, cool. So people are creating technologies for health. I was very happy and inspired. Okay, hopefully we can see these things coming in soon. So eventually I ended up judging one of those teams. So I told the team, like, if you ever wanted to collaborate, I hope to advise you on what you would need to do, at least business-wise, or probably even in terms of coordination with government, etc., in order to make it flourish. So that was around October, and then sort of kind of forgot about it. And then a couple of months later, I think December, I ended up getting a message when they wanted to meet. And eventually we got together and decided that there really is this gap that needed to be filled. And this is actually before the pandemic. This was around 2019. And we ended up talking about it. And eventually we decided that maybe let's try to develop a startup that would help address these concerns. So they would be coming in as part of the tech side. I'd be coming in as the business, as the health, and government insight individual. So that's how technically Alaga Health was born, a merging of two worlds, the tech side and the health and business side. And then by that time, 2020 came and then the pandemic hit, right? So, and then we saw all of these new developments coming into the health world. Like the attention was in health, a lot of people developing tech now. So for us, okay, that's great. Yeah. Because although they're quote unquote competition, it was good to see that a lot of people were now embracing the use of tech in health, because that was something that was not evident at that time. And coming from government, I also saw, and this is something I discussed with some of the high-ranking officials of the Department of Health, where in general, government does not like investing in technology that will not immediately reach those that are hard to reach, particularly those that are in the quote-unquote borders of society, or those that are most affected because they're isolated or they're in depressed areas. So that, of course, would rule out any quick advancements in mobile application development, in web application development, and all of these things. So I ended up realizing that this needed to be something that the private sector had to do. Hopefully in collaboration with government. So that's where Alaga Health actually came about. So we saw all of these new things coming up, and then we decided, like, what is our place in all of these things? Like, we are young, we are small, we don't have a massive war chest in contrast to these big, gigantic corporations. What would be our role? What would be our edge? What would make us different? So while they're working on the tech side, I had to bring in everything that I've had engaged with in the past, primarily working with patient groups, with NGOs, with civil society organizations, my familiarity with working with government, to somehow bring together a platform that will link all of these things and to give patients better choices. Primarily because from experience, a lot of patient groups and NGOs have a lot of engagements with people who are already sick, who are actively looking for care. But one of the things that really prevent them from accessing care would be either the price or the knowledge as to where they can go or what place would be appropriate for their condition. And all of these lack of awareness and knowledge was something that needed to be filled. And at the same time, coming from the perspective of a nurse and a doctor, wherein, as we all know in the Philippines, nurses are our number one export, quote unquote, wherein the world knows that the Philippines produces so many nurses all over the world.
Number one. It's a number one exporter of nurses.
Exactly. Yeah. And we had to ask, why is it? Because I also had a chance to work with a nurse advocacy group, among many other NGOs. So we saw how a lot of nurses were leaving because they didn't find a lot of opportunities in the Philippines. So we needed to fulfill a need that was not only facing the patients, but also the health workers. Because right now, as I speak, a lot of my colleagues, a lot of my fellow medical graduates are considering flying off to another country because of lack of opportunities here or insufficient gainful employment here. So we wanted to create something that would address the needs of not only the patients, but also the ones providing the care, because it is a balancing act. Not only just focusing on what would benefit the patients in terms of the price or accessibility, but also what would be a sustainable way of a career or employment for the health providers. So this is where the idea of a marketplace and a service hub came to be, wherein we make them meet and we make the market somehow take over, wherein we make both sides agree on what would be the best way to move forward, wherein a health provider can adjust their price, the way that they conduct their practice, whether here or abroad or whatnot, and the patients would also be able to pick and choose and give them the incentive to drop their prices and at the same time provide good and quality service.
That's so good. That's so good. So tell us where you're at today with Alaga Health. What's happening now and what's next?
Yes, we're very excited because our baseline tech is done. And of course, it will be further improved with more features added, etc. So our tech is done, and that took the most time because the truth of the matter is, and I'm not afraid to say this, and I'm actually kind of proud of saying this, we're in bunch of our funding, actually a significant part of our funding came from competitions, came from grants, came from hackathons. And therefore, we're not beholden to a giant corporation or a large entity to an extent that we are unable to pursue our purpose, our vision. So to some extent, we are literally community funded and community driven because people see the value in making what we want to happen actually materialize. So and that's something that is both something that we're proud of and hopefully that we can share with others and hopefully inspire others to probably help Alaga Health move forward, because the truth of the matter is tech is expensive. Tech development is super expensive, but to see the support of the communities and the funders from developmental institutions, etc., it's really driven us to keep moving forward. And now that at least the baseline tech is done, we're now tapping our partners and friends, our NGOs, our patient groups, and now really diving into our LGU partnerships. Because one of the major things that we need to take into consideration is that government has a huge role to play, particularly because they are the individuals, or at least the barangay health centers, their barangay health stations are the ones that people go to for healthcare in general, apart from, of course, your private institution. So collaborating with them would enable us to reach more people at a faster rate, because we don't have the luxury of a massive war chest in contrast to these large corporations. But what we can do is offer our services to those that are actually in need of it. Because again, as I've mentioned, government usually does not like investing in tech that doesn't immediately reach those that are in isolated areas or in depressed areas. That's where we come in, and we hope to provide and collaborate with them, provide a service and collaborate with them in order to make healthcare that's already in existence more accessible and probably more efficient than if they would have to do it the usual manual way. So at the same time, we're very excited because of our efforts. We have been recognized just recently. Actually, our company just finished our first international showcase in Geneva, Switzerland. We were invited by the United Nations' World Intellectual Property Organization. And we also got support from the International Federation of Pharmaceutical Manufacturers and Associations and an International Trade Center, because they found the business model very interesting.
Yeah.
Serving as an amalgamation of private sector initiatives, government, and even NGOs. And that was pretty unique enough for them to want to support and hopefully want to somehow protect in terms of business model, because we cannot do much in terms of matching the war chest of large corporations. What we can do is really match the way that we protect our IP, the way that we collaborate with large institutions that are hopefully going to allow us to work with different institutions. And also, we're very thankful that there was a very positive reception when it comes to the Filipino international community as well, because we were also endorsed to and endorsed by the Philippine mission to the United Nations, hoping that we could hopefully introduce our solution to other places outside the Philippines, primarily because we saw that a lot of OFWs or even a lot of Filipinos living abroad really wanted to talk to a Filipino health professional for their health concerns. And that's something that we saw as something that needed to be filled moving forward.
Yeah.
Wait, hold on. I'll just let my office dog in. Hold on.
That's wonderful. Thank you for the update, and congrats on all the recent exposure and milestones, even in an international level. That's super cool. And and then of course engaging OFWs. So right now on Alaga Health, so you have users both in the Philippines and abroad. Yeah.
We're trying to grow our user base abroad as well, because one of the beautiful things about telemedicine is that it can cross borders, and that it's the equivalent of, say, a doctor in the Philippines suddenly going on vacation in the US or in the UK and suddenly consulting with their patient via mobile device just so that they can continue the care. So it's basically the same thing. And that really cuts across the need for the issues on fragmented healthcare, because it really exposes the accessibility that can be experienced right now because of all the latest developments in tech.
Yeah. And to your point, in the future, it just allows opportunities for our healthcare workers to stay where they are, hopefully, and still be able to provide care in a sustainable way.
Actually, that's one of the driving forces for me as well, because another side story for me is that when I was still studying as a student nurse then, my grandmother was struggling with or coping with chronic kidney disease, and she was undergoing peritoneal dialysis, and we needed to have a nurse to help take care of her while she was at home. And we were struggling just to find one that's available, because there was no way for us to immediately search for one at least at that point in time, through the net, etc. It was always about who do you know, sino kakilala mo. That's the usual Filipino strategy when it comes to healthcare. Sino kakilala mo cardio, sino kakilala mo ganyan. It's always that relational experience, right? And unfortunately, she ended up passing away. And what struck me was that all that time we couldn't find a readily available nurse. Not knowing just a couple of blocks away, there were nurses actively looking for a job as they prepared going abroad. So that disjunct in terms of awareness and knowledge regarding the availability of healthcare professionals was something that added that extra push for us, or particularly for me, to keep going with Alaga Health.
Yeah. Yeah. No, that's a very unfortunate situation, but yeah, I'm encouraged by how you're working. You're not just complaining about a situation or being, disappointed by the situation, but are actively working toward a solution so other Filipinos don't have to face that same problem. And what an encouragement, and so inspiring, Dexter. And I know you're just beginning, but less than 3 years, technically, right?
Yeah.
Less than 3 years pa lang, but so much impact already, and so excited for what's next for you as a person, really. Alaga Health is one thing, but just you as a person, your story, your journey, it's so encouraging and inspiring for me, and I'm sure many others here. And kudos to your parents, praise God for them and the way that they were intentional as well in being present in your life, and, you being able to see their example of building a business. And now you get to build on that. You get to build on that foundation that they have, and that's the floor for your dreams, right? Man, what a blessing and encouragement. And my last question for you as we wrap up our time is, for those listeners who might be in their idea stage, maybe they have a growing insight, or they have some kind of passion about a certain problem, what would be your encouragement for them or advice for them as a next step to move from idea to action?
I suppose it would be, don't be afraid to begin. And also, don't be afraid to seek help. Because eventually, all of these things will come together, especially when you're working towards a greater purpose. And I would usually do a lot of talks and conduct a lot of trainings. And I would always end my discussions with something I said once in a talk and I ended up repeating over and over again. And this one is particularly targeted towards young people, particularly those who are afraid to begin because they feel that they don't have enough experience, they don't know enough, or they can't start a business because it's too complicated. I would always say that the youth are done waiting for the world to change. The world is now waiting for the youth to change it. And I suppose you can tweak that a bit in a sense that since we're championing the ventures of Filipinos, it's that the Filipino people are done waiting for the world to change, and that the world is now waiting for Filipinos to change it.
So good. Thank you, Dr. Dexter, for spending time with me today. Love hearing your story and can't wait for what's next.
Thank you so much, Christine.